Ifosfamide is a medication used to treat different types of cancer, such as testicular cancer. It works by slowing down or stopping the growth of cancer cells. It is important to follow the recommended dosage and take it at the optimal time for the best results. When taking Ifosfamide Vial, it is important to note that it is administered through an injection into a vein by a healthcare professional. The dosage of the medication is determined based on your medical condition, body size, and how you respond to the treatment. If the medication comes into contact with your skin, it is crucial to wash the area with soap and water immediately. If it gets into your eye, you should flush it with water for 15 minutes and seek medical help right away. To prevent urinary problems, it is recommended to drink plenty of fluids and urinate frequently, unless otherwise directed by your doctor. Your doctor may also prescribe other medications, such as mesna and intravenous fluids, to decrease the risk of urinary problems. Side effects of Ifosfamide Vial may include nausea, vomiting, diarrhea, stomach/abdominal pain, loss of appetite, or redness/pain/swelling at the injection site. Your doctor may prescribe medication to prevent or relieve these symptoms, and eating small meals, avoiding alcohol, and limiting activity may also help. Severe nausea, vomiting, and diarrhea can rarely cause dehydration, so contact your doctor if you notice symptoms such as decreased urination or dry mouth. Mouth and throat pain or sores may occur, and gentle tooth brushing and avoiding alcohol-based mouthwash can help. Temporary hair loss may also occur, but normal hair growth should return after treatment. Tell your doctor right away if you experience numbness/tingling, signs of heart problems, changes in urination, vision changes, or irregular menstrual periods. Seek medical help immediately if you have a seizure or signs of a serious allergic reaction. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. Ifosfamide Vial can cause serious and even fatal side effects, including urinary problems such as hemorrhagic cystitis, mental and mood changes, and blood or bone marrow disorders. These side effects may require your treatment with this medication to be stopped. You should tell your doctor immediately if you develop symptoms such as pink or bloody urine, frequent or painful urination, severe drowsiness, confusion, unusual changes in behavior, or hallucinations. Blood and bone marrow disorders can affect your body's ability to stop bleeding or fight infection, so it's important to let your doctor know right away if you develop easy bruising or bleeding, or signs of infection such as a sore throat that doesn't go away, fever, or chills. Be sure to follow your doctor's instructions carefully and report any concerning symptoms promptly. Before taking ifosfamide, it's important to discuss any allergies you may have with your doctor or pharmacist. Also, make sure to inform them of your medical history, including any blood or bleeding problems, infections, heart issues, kidney or liver disease, or any past radiation treatment. If you experience drowsiness while taking ifosfamide, it's essential to avoid alcohol or marijuana, as they can increase drowsiness. It's also important to refrain from driving or operating machinery until you can do so safely. Limiting alcoholic beverages is also recommended. Ifosfamide may increase the risk of infections or worsen existing infections. It's crucial to avoid contact with individuals who have contagious infections like chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to consult with your doctor for further guidance. Before receiving any immunizations or vaccinations, inform your healthcare professional about your use of ifosfamide. It's also important to avoid contact with individuals who have recently received live vaccines, such as the flu vaccine inhaled through the nose. This medication may slow down the healing process of wounds. To reduce the risk of injury, use caution with sharp objects and avoid activities like contact sports. In some cases, individuals treated with ifosfamide have developed other types of cancers. It's important to discuss this risk with your doctor. Prior to undergoing surgery, it's essential to inform your doctor or dentist about all the medications and herbal products you are using. Ifosfamide can impact fertility in both males and females, so it's important to discuss this with your doctor. If you are pregnant or planning to become pregnant, it's crucial to avoid becoming pregnant while using ifosfamide, as it may harm an unborn baby. Women using this medication should inquire about reliable forms of birth control, and men using this medication should also ask about reliable forms of birth control during treatment and for up to 6 months after the last dose. If pregnancy occurs, it's important to speak with your doctor immediately about the risks and benefits of continuing this medication. If you are breastfeeding, it's important to consult your doctor before using ifosfamide, as it may have negative effects on a nursing infant. When taking Ifosfamide Vial, it's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. Always keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and make sure to share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Ifosfamide Vial. If someone has taken too much Ifosfamide Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It is important to have regular lab and medical tests while using Ifosfamide Vial, including complete blood counts, blood salt/mineral levels, and kidney function. Make sure to keep all medical and lab appointments to ensure the medication is working effectively and to monitor any potential side effects. Be sure to take each dose of Ifosfamide Vial as directed by your doctor. If you happen to miss a dose, consult with your doctor or pharmacist to determine the best course of action for your new dosing schedule. Be sure to consult the product instructions and your pharmacist for storage details. It's important to keep all medications away from children and pets. Also, do not flush medications down the toilet or pour them into a drain unless instructed to do so. When this product is expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.